This is Hubwonk. I'm Joe Selvaggi. Welcome to Hubwonk, a podcast of Pioneer Institute, a think tank in Boston. Consumers price shop for everything, from a gallon of gas to airline tickets to groceries. The same is not possible in healthcare. Despite costing every American an average of more than $12,000 per year, price information for nearly all healthcare procedures is beyond the reach of ordinary consumers. This dearth of information contributes in no small part to the overall rise in the cost of the US system, making otherwise value-seeking consumers into unwitting accessories to healthcare inflation. Surely, if armed with the relative costs of procedures amongst regional hospitals, cost-conscious consumers could shop their best value, thereby encouraging better prices for everyone. What, if anything, can policymakers do to require hospitals to provide price information? And what would be the effect of price transparency when consumers are empowered to choose the best value? My guest today is Pioneer Institute's Senior Healthcare Fellow, Barbara Anthony. Ms. Anthony has recently released a paper entitled Massachusetts Hospitals' Uneven Compliance with New Federal Price Transparency Law, which outlines state and federal mandates for hospitals to provide prices for their most common procedures, and examines the degree to which our hospitals do offer shoppable prices for procedures in a consumer-friendly format. Ms. Anthony makes the case that price transparency compliance can serve to empower healthcare consumers to make choices that lower overall costs while providing hospitals with incentives to control costs and provide better value to everyone. When I return, I'll be joined by Pioneer Institute's Senior Fellow, Barbara Anthony. Okay, we're back. This is Hubwonk. I'm Joe Selvaggi, and I'm now pleased to be joined by Pioneer Institute's Senior Fellow in Healthcare, Barbara Anthony. Welcome back to Hubwonk, Barbara.
Oh, thanks. It's great to be back, Joe. Great to see you again.
Indeed. It's been a while since you've been on the podcast, but you've been busy. I know you've been an advocate for price transparency, among other things, in the healthcare system. It's a topic and a theme we do touch on quite a bit here at Hubwonk, but you've written a very interesting piece recently entitled Massachusetts Hospitals' Uneven Compliance with New Federal Price Transparency Law, which is very critical of our Massachusetts hospitals. You take them all to task with what the expectations are for price transparencies, who's doing a good job and who's not doing a good job. So let's I want to dive into the observations of the paper, but let's take our audience back a little bit and describe for them, why do you think, whether it's healthcare or frankly any other market, why is this so important for individuals, consumers, to know what the price of what they're buying is?
Well, it's pretty, I don't want to say it's pretty cut and dry, but it is kind of cut and dry, because that's how, knowing the price of a product or a service and knowing its quality, this is how we make decisions about what to purchase, what not to purchase, and so on. And, whether it's a commodity, a service, whether it's a medical procedure, all of that information about price is very, very important to our determinations as to whether we're going to spend our money in a particular place or for a particular service. So that's the way a free market operates, basically. I don't want to get too simplistic about it, but it is basic, supply and demand. And we then allocate our dollars among those goods and services that we choose in terms of the best price quality option for each of us. So yeah, it's a pretty important concept in our economic system.
So prices allow us as consumers to make choices. We want to get the best value for our dollars. So we want, best bang for the buck, whatever cliche we want to use. But what does having prices in the hands of consumers do to the prices themselves? Like, if we know what prices are and we can choose, what does the effect in the marketplace have of having that choice? What do prices do when choices are provided?
Well, if prices are too high for particular items, let's say, I'm trying to think of something right now. Let's say gasoline, that's an example here. We've just gone through a lot of angst over gasoline prices. And, one result of that is that people perhaps were driving less because they really couldn't afford to pay high gasoline prices, or they wanted to conserve it for whatever reason. So people altered their buying behavior in response to price signals. Basically, that's it. So you might not take that cross-country trip if it's going to cost you $100 to fill up your tank every time you have to go to the gas station, you wait for prices to drop. So you'll postpone things. You won't purchase the gas at this time. You'll wait for it to come down. I mean, the real estate market's another example right now. I know a lot of people who are in the market to buy, and especially the Massachusetts housing market, which is pretty high. They're kind of putting things aside right now. They're waiting for prices to either level off or for sellers to become more receptive to offers, or for prices to perhaps drop, which I don't think that they ever do. But it alters prices. Price sends us a signal, and we alter our buying behavior in accordance with those signals.
Indeed. So we, as consumers, we control it. But three things happen, right? As you say, we might choose alternatives. We might come up with substitutes to take the bus instead of driving. But also tells producers produce more of it if the prices go up to the point where they become more commoditized, if you will, and they become, the prices ultimately come down into equilibrium. So let's take these very conceptual concepts. We were talking about gas and houses and bring it down to healthcare. So if we assume that price transparency helps consumers choose and therefore drives prices downward, we like to talk about how much healthcare costs are and how they keep going up. Why is it that, given that we like to have prices for gas or for houses, why is it that it seems that consumers don't seem as sensitive to prices when we walk into a hospital, per se?
Well, because particularly in Massachusetts, consumers do not directly pay for the price of healthcare, because most of us, fortunately, are insured. About 97% of Massachusetts consumers are insured. So we pay insurance premiums, and there is a direct connection between the cost of healthcare and the premiums that we pay, but most of us don't see it that way. We may have a $10 copay, a $20 copay, $50, even $100. That's what we see. We don't see that the MRI at one hospital costs $5,000 and in another hospital costs $1,000. We see the $20 copay we have to pay. Now that's not true for some people. Some people have large copays, thousands of dollars. For those people, I believe that those folks are price sensitive. I think a problem is that they don't know how to obtain the price of different healthcare services, where they have to spend their large deductible before their insurance kicks in.
Indeed, those are the marginal consumers, and those are the people who do determine price, right? Bill Gates can afford gas at any price, and perhaps procedures at any price. It's those marginal consumers that are what drive prices down. But you point to a very, something we've talked about on this podcast many times. There's a disconnect between what we spend with our, when we walk into a hospital, and what we actually pay when we get our premium, our healthcare premium. At the end of the year. So we all sort of in the back of our mind know the more we spend collectively on healthcare, the higher that premium is going to go, but we don't really internalize that when we go and make choices inside a hospital. So there's fundamentally a flaw in the system that doesn't share with us how much we actually spend when we visit. So to that end, but if for that marginal consumer, price is important. What's been done? You're sort of a historian when it comes to healthcare transparency. What has been done, let's say here in Massachusetts, we're on the vanguard of certainly high quality healthcare. What have we done to ensure that healthcare and those healthcare prices are transparent to Massachusetts consumers at the state level?
Well, first, let me say one thing before I answer that, is that I wouldn't characterize these consumers with high deductible plans as marginal. 11% of the insured population in Massachusetts, I'm not talking about Medicaid, funded consumers in terms of healthcare, but private insurers. 11% is a large number, and those folks have at least a $3,000 or more deductible. So that's a good chunk of the population. They're not marginal. Their problem is that they can't.
I didn't mean marginal in the sense that they are on the margins. I meant
no. I meant that they're not just small. There's just they're not Bill Gates. They're 11% is not a small amount. It's Indeed. A good amount. That's what I mean. But they're not. I think the problem they have is the problem that everyone has in terms of healthcare prices. We don't know how to obtain them. We don't know how to find them. It's not an easy task to do. It's intimidating. You're dealing with healthcare. You want to ask your doctor how much this visit's going to cost when you're sitting there? The doctor's looking at his watch and his computer, not looking at you, of course. But so it's unfortunately, you said I was a historian in this. I've never thought of myself as a historian, but Pioneer has done probably more of these price transparency surveys among hospitals, doctors, specialists, dentists, drugstore retail prices, and also insurance companies, health insurance companies, than probably any think tank in the country. So here in Massachusetts, we've done about 7 of them since about 2017. And the results in terms of providers, and by providers, I mean hospitals, doctors, specialists, has not been great. We did the first one in 2017 because we have a law in Massachusetts that says hospitals need to give you information about the price of a procedure before you go there. Very bad results. Fast forward to 2022, we just released this new study in terms of compliance with the federal law, and we saw some improvement, but it was not terrific. So I think, over the years, there has been, if you want to take a historical view, and I think that's a good one to do, to take, is that transparency has not improved a great deal. And that is notwithstanding, we have state laws that require price transparency for providers and for insurance companies. Let me say insurance companies do a better job than the providers do. But we have a federal law with respect to providers that's already in effect and has been in effect since 2020. So we've got the laws. We don't have a lot of compliance. And what was a problem many, many years ago is still a problem today.
So I want to drill down. So at the state level, we've dabbled in asking our hospitals to be more transparent. But as you mentioned, it came into effect in 2020. It was the Public Health Service Act and the along with CMS, the Center for Medicare and Medicaid, they promulgated regulations to mandate more transparency. You list them in the paper. I don't know if they're at your fingertips, but what let's say in a perfect world, what does that act ask hospitals to do? What does transparency mean in the eyes of the law as it's written now?
Okay, well, that's a great question. And on the federal side, it's a pretty clear-cut answer. All hospitals across the country, now this is not just Massachusetts, of course, are required to put on their websites. And I want to make that clear. This is an online law. To put on their website various prices for we call 300 shoppable services. All right, you have to put that up on your website. And what kinds of prices do they have to put up? They have to put up the prices that they actually pay to insurance companies. And they have to put up the price that a consumer who's not insured would have to pay to the hospital. So those are 2 general areas of prices that have to be posted.
So insurance and a cash price, if you will, for lack of a better term.
Yeah, that's right. Right.
Mm-hmm.
So that's, I mean, it's kind of a simple directive in terms of this information that has to be on hospital websites. And that's what we took a look at. We went to the websites to see whether or not hospitals were doing what the federal law says they should do.
So it's online, and you mentioned the term shoppable. I want to dig a little deeper on this, but before we get there, how many hospitals were in your survey when you did your analysis? I assume, did you throw the net to everyone, or did you try to take a good sampling of all types of hospitals?
Well, we always, in all of the studies that Pioneer has done, in Massachusetts, we've taken a sample of hospitals. There's approximately right now 61 acute care hospitals around the state. We sampled 19 of them. Our previous studies have done 20, 21. At one point in time, when we started out, there might have been 65 hospitals or 66, something like that. But there's been there continues to be consolidation in the hospital marketplace. So we have fewer hospitals as time goes on. So but the quality of the sample is what's important. And our sample includes basically all the major hospitals, all urban hospitals, suburban hospitals spread around the state. So it's been the same cohort of hospitals that we've been sampling now basically since 2017.
So you mentioned 300 procedures, shoppable procedures. We don't have to go through all 300, but
no, I don't.
Right. I'm sure that's not where we want to go. I wanted to just, in a sense, say when I hear shoppable, I think, again, I mentioned this term earlier, more or less a commodity, meaning an MRI at Mass General and one at a rural hospital. One has to assume there's somewhat of a commodity. An MRI is an MRI wherever you go. That to me, that's what shoppable means. I have to be able to compare apples with apples,
Oh.
to use a cliche. Is that what we're talking about here? And if
Well,
so,
yeah,
go
yeah. I
ahead.
mean, yeah, yes and no. Yes and no. I think this is the way the government did it. CMS, the Centers for Medicare and Medicaid, as you mentioned earlier, they told hospitals, you have to publish prices for 300 shoppable services, but we're going to give you 70, that's 70, and you must do these 70. They were picked by CMS. Hospital, then you can go ahead and fill in the other 230 for your total of 300. So we have 70 prescribed, and they are, many of them are pretty routine: electrocardiograms, MRIs of your joint, of this and that, brain scans, to really more sophisticated and really highly technical medical services, such as heart surgery, brain surgery, and things of that nature. So, I mean, some of the shoppable services that CMS has in their list are pretty. They cost hundreds of thousands of dollars, and as a realistic matter, you're not going to be shopping for that kind of a. So you're right. What you're looking for is the more routine things, which comprise, much of what we spend in terms of healthcare. So that's the kind of thing. I mean, I can give you, if you let me cheat for a second,
Sure,
couple
sure.
of
Go ahead. If
things.
you've got it in front of you, just, again, our
Yeah,
listeners are trying to
mammograms, electrocardiograms, that
Okay.
kind of thing.
Indeed. Okay. So that people
Very
understand,
common.
okay, I'm heading for one of these tests. Let's find out where I can find the best price. Now, another concept in your paper you mentioned quite a bit is that the information has to be consumer friendly. So we've got this mandate for a particular 70 shoppable procedures. Now that information for that price has to be consumer friendly. How is it? I mean, we all, I hope almost all of us are able to get online and find prices for airlines and, whatever. What does consumer friendly information for a electrocardiogram look like? How do you define it, or is it defined?
Well, I don't, the federal government, unfortunately, did not define it. So that's a good question. In other words, the CMS, as you mentioned before, they don't say to hospitals, this is what we consider to be consumer friendly. It has to be easy for someone to go to your homepage and then to get from your homepage to the price of your MRI. They don't give that kind of instruction to hospitals. All they say, and these are the words, quote unquote, consumer friendly. What we did when our researchers did in terms of the studies, we went to these 21 hospitals and we went online and we actually documented how easy or how difficult it was for our researchers, and they're pretty smart and they're very technically astute, but we're trying to be ordinary consumers, but how difficult or easy was it to find a price going from the homepage to the price listing, wherever that was buried within the web pages of the hospital. And in some cases, it was pretty hard. In some cases, it was a circuitous, roundabout route. Some cases it wasn't. It was pretty easy. So it varied. And one of the things we recommend, Joe, in our findings here and recommendations, is that the federal government define what consumer friendly is, and that they tell hospitals, why don't you put a link from your home page, that first page that people go to, directly to the pricing information? Why don't you do that so that folks go to the home page, they see the link, and they can go directly and find out what a price is? But that's something that they have not done.
Indeed. So this has been
good searching. Good luck searching.
Right. Well, this has been a big buildup, and so I do want to ultimately come to the conclusion or the observations of the paper before we go to the recommendations of the paper. But we've touched on all the issues involved. So ultimately, you've looked at these hospitals. You've taken a survey. You're looking for these shoppable products that are and the information being consumer friendly. This mandate has been around since 2020. It's now 2022. Go ahead, tell us, how did our hospitals do?
Well, the answer is not great. As we said in the title to our report, compliance is uneven, and that's kind of a polite way of saying, it really could be a lot better. So what we found is that 36% of the hospitals we surveyed did not have this discounted cash price information available for consumers. It just isn't there. We checked, we double checked. We didn't just go once, our researchers were very thorough. Could not be found. So, but that said, there's 64% around there, around that percent that did provide discounted cash price. That didn't mean that they did it for all of those services that they're supposed to. That type of compliance varied from like 60% of the services that they're supposed to post the cash discounted price for to 95%. So it varied. Compliance, when there was compliance, also varied among the hospitals. What we found, and that finding about compliance with the federal transparency law was, somewhat consistent with the findings from our previous reports that began back in 2017 in terms of an unevenness among hospitals with respect to making prices available to consumers in an easy, consumer-friendly way. So again, as I said when we started talking, unfortunately, not a lot has changed on the provider front here.
Well, your paper also did, beyond saying, many of the hospitals, I guess a little more than a third of the hospitals have really little or no useful information for consumers. But those that did provide the information, the actual cash or price for consumers, you found huge disparities amongst what we've identified as shoppable, that is something approaching a commodity where one can expect a similar procedure to happen in one place as another. Share with our listeners the range, once you have that information, what did your researchers find as far as the range of prices?
Well, they range considerably. And if I can give you a couple of examples here, let's just say an MRI of a leg. MRIs are very common. We're all getting older. We all need our knees replaced, our hips, whatever it might be. So MRIs of leg joints, whether you're young or older, is certainly a service that everyone can identify with. And there, we have prices that range from, and I'm going to use some names here because our study certainly does. So for example, Carney Hospital, all right, in Dorchester, for an MRI of a leg joint, $775. And if you want to go to Brigham and Women's, $3,461. So
I don't know.
think about that for a minute, okay?
Yeah, did your test talk about how far apart those hospitals are? We're assuming these are both
yes, it did.
equal quality, and how far,
I think they're 10 miles apart.
10 miles, right? I don't know what the cab price would be, maybe $40, but
right.
3,000 versus 700, right?
Right, yeah. And let me give you another one. This one isn't quite as large. Well, here's an ultrasound of the abdomen, another common procedure. Many people have to undergo this, and there the disparities aren't quite as large, but they're still not insignificant. And again, Carney in Dorchester, $482, so say $500. But let's go over to Concord, Mass. There is obviously a difference in travel there. At the Emerson Hospital in Concord, about $1,100. So you have $500 at the Carney, you have $1,100 at the Emerson Hospital in Concord. Now, you do have to ask, anytime you see these kinds of price disparities, particularly if I can go back to the MRI of the leg joint with Carney at $775 and Brigham at almost $3,500, what is it about an MRI of a leg joint that makes it 4 times more expensive at one hospital than another? Or what is it about an ultrasound of the abdomen that makes it twice as high at one hospital than another? I don't think there's any answers to that question. And if I can just digress for one quick minute here, in terms of hospital costs, we really do have to, we have very high costs in Massachusetts, as we know. The whole country has high healthcare costs. The problem is that hospitals themselves don't know what their own costs are. So a lot of the prices that we're seeing may not be necessary at all, because the hospitals themselves don't understand their own cost accounting procedures. And that's because they don't follow the same kind of costing methodologies that every other industry in the country does. They don't, I don't want to get into a whole digression here, but that particular point of hospital cost accounting being very problematic is one of the reasons why we see these disparities. These disparities also reflect something called market power. and everybody knows what market power is. It's the power to command a higher price than your competitor because you might be offering some kind of a better value. Studies have shown here in Massachusetts that that especially in terms of these shoppable services, the ones that we've just been talking about, there's not there's not a lot of difference with respect to quality. So you have the same procedure, you have the same quality, and yet you have these 2 times to 4 times difference in prices. And so how is that explained? It's called unwarranted price variation, by the way. When you subtract out any quality component, you find out there isn't any. Why are these prices this way? And the reason is very simple, because they can get those prices. Because I have the power to charge my my insurance company customers or my other customers, employers or whatever. I have the power to extract that kind of price. That's what market power is.
Indeed.
That is a big problem. That's a big
can
problem.
we imagine paying $5 for gas in Dorchester and $25 for gas in
Right, no, you can't.
Brookline?
Exactly.
So
Exactly.
it's absurd.
Exactly.
But
Good example.
I find it less mysterious, because I just say, as you mentioned, hospitals don't know what their procedures cost or what they charge. It's because it's, your overpaying is their profit. So they're paid handsomely to not know this information. There's of course, that's perhaps obvious to our listeners as they listen to this story unfold. What I like about your paper, though, beyond just saying, look, this is a problem, it's costing us a lot of money as healthcare consumers, you do have some, I think, very, very useful recommendations for what hospitals could do themselves to improve their transparency. So let's start there. What if you were head of Who Scored a Zero, our very own Mass General? I can see out the roof of it out my window. What would you do if you were king for a day and were head of Mass General and you wanted our consumers, be they cash healthcare consumers or small businesses? What would you do to make your hospital more transparent?
Well, I will say this much in terms of Mass General. You just happened to pick. I mean, you picked a good hospital to talk about, but in our survey, they actually did very well in terms of, not in terms of price disparities. They're always on the high end, but in terms of transparency, they are telling you, they were in compliance there, but still. So let's just say, Leahy didn't come out so great in some areas, and there were other hospitals too. But there should be one person in charge of price transparency in the hospital, because there isn't just a federal law. There's also state laws. And what we found in doing the work that we've been doing at Pioneer is that it really takes a culture. Transparency is something that has to become acculturated within an institution. And in order to do that, you have to empower your managers, your administrators. So there needs to be some empowerment with respect to an office that is completely in charge of price transparency and making sure that consumers have it. So all of these things that we talked about, the website not being consumer friendly, prices not being posted, all of that can be in one person's responsibility or one office's responsibility. So that's the first thing that we do recommend. We also do recommend that hospitals make it easy on their websites. As I mentioned earlier, we recommend that the federal government get involved here and define consumer-friendly transparency. But if they're not going to do that, then hospitals can do this, and they can put a link on their homepage to the pricing information. That is a very simple thing to do, and they should do it. The other thing that one of the things we recommend that I found, I actually found myself, because I did roll up my sleeves, as I always do in these studies, and work alongside the researchers, because I want to see what we're seeing. I went to one hospital and in Boston, and in order to get price information, I had to give my name and my birth date and a phone number, and I really found that offensive.
Mm-hmm.
I put I'll tell you and our viewers a secret. I didn't use my real name and I didn't use my real birthday or my real phone.
I don't blame you. You're
But
forgiven.
but I thought, but this is, you should not be doing this. And there's nothing, that's one of the things that's kind of silent in the law. But if we're putting prices out, why do we have to identify yourself? That's supposed to be public information. So I would say, let's get rid of that kind of intrusive, acquisition of personal private information. All people want to know is the price. You don't need to know how old they are or what their name is or where they live. So no, that's number 3, I think. We also pointed out that in Massachusetts, there's something called the Attorney General's Community Benefit Guidelines. And in our report, we did recommend that compliance with these various price transparency laws is something that the Attorney General's office should look at in terms of its community benefit guidelines and the adherence of hospitals to those guidelines. But we also pointed out that there's room for the legislature here and also the executive branch of the government to incent hospitals to comply. If I can give you an example of this.
Sure. So we're going to talk about, okay, at the state level, if you were a legislator, I'm changing your title from head of the hospital to now an activist on top of Beacon Hill. What would you do to improve the state?
Well, I'd look to see what we can do to provide some incentives. Colorado, for example, passed a law that said if a hospital does not comply with this federal law, the law that we've been talking about that's been administered by CMS, then that hospital cannot collect medical debt. Now, we didn't recommend that Massachusetts follow that, but to take a look at what we can do to provide some incentive. All hospitals are regulated by the Department of Public Health. There are some other regulatory agencies involved, but DPH here in Massachusetts is the primary one. I mean, hospitals are audited. They are regulated by state authorities as well as federal authorities. This compliance with this should be part of a checklist. And, there's the federal government can impose fines on hospitals and does for noncompliance, but the state can also provide, I'm more in favor of using a carrot in these situations. But, the state can publish a list of hospitals. Why does Pioneer have to do this? Why isn't the state looking to see whether or not hospitals are complying with these state and federal laws? Why doesn't DPH publish some kind of a list so that consumers know, oh, if I want to go to hospital ABC, I'll be able to find out the price of things. But if I go over here, they're not on the hospital transparency list. There's a lot of ways to use the bully pulpit of both the executive branch and the legislative branch to incent compliance. We really haven't done any of that, frankly, which is disappointing.
Indeed, and then were the state to simply furnish compliance rates, then again, the power of the market would take hold, and then we get down to the actual consumers, be they small businesses, big businesses, and individuals who with high deductibles, as I mentioned. You said 11%. I'm characterizing them as people who have, let's say, high elasticity of demand. They can make those choices based on price. The market can take hold. In other words, there's now a healthy incentive to be transparent, and therefore hospitals use markets or the power of markets to comply rather than either a carrot or a stick. I guess that would be a carrot, right? They want more consumers, so they want to be more consumer friendly, and everybody wins in that situation. That's great. Again, and finally, as consumers, what can we, beyond reading your papers and being wonderful followers of Pioneer, what can consumers do to encourage a more transparent healthcare system when it comes to price?
Well, I'll divide consumers into 2 groups. You folks like you and me, if we're sort of ordinary people, and we can be more inquisitive about what things will cost, even if we have good insurance. We should be. Most of us should realize that you're going to pay. You pay one way or the other. You're either going to pay directly or you're going to pay through higher insurance premiums. So, question: when a doctor says you should have X, Y, this particular test or that test, do I need this? How frequently do I need it? Try to find out what the price is at a particular facility, and do a little bit of shopping yourself. Try price conscious. It's always fun just to ask your doctor how much something costs, or to ask the office how much something costs. You may be surprised. You may get an answer. You may not, but you may also get an answer. So the other thing that people can do, and this is really directed at companies, employers, large and small, there's a lot of data out there from this federal law. And what we've been talking about is the data for consumers, prices for consumers, but there's another side to the law, Joe, that we didn't cover. And this is called data that's in a machine readable format. It's really made for employers, large employers and small employers, to get the information that we've been talking about. How much did this hospital pay, or how much is XYZ insurance company paying this hospital for a particular service? That information is available. It is out there. And it's very useful for employers to know what their these hospitals, what are they getting paid for certain services, and how much are you paying, that particular employer? Are you getting the best rate for your people? So I think that more work can be done by employers and among employer groups to also be cognizant of transparency and to try to cut the best deals possible for themselves and for their companies and for their employees.
So we're not just blaming other people, we should be blaming ourselves and demanding of ourselves a little more, as you say, inquisitiveness and demanding the prices that we're not getting yet. Well, this has been a terrific conversation about this interesting paper. Where can our listeners find your survey, your research, your paper done by Pioneer?
Go to the Pioneer website, pioneerinstitute.org, O-R-G. Search the website, pretty consumer friendly, I will say.
We're transparent.
And go to look for healthcare or health policy. I forget what the exact words, but look for the words health on there and do some searching, and it's pretty easy to navigate the Pioneer website. But you'll find this study and then all the others that we've done in this area, in this particular topic.
And that's wonderful. You can find the hospital you like to go to and see how well they scored on transparency.
That's right.
That's wonderful. Okay. Well, thank you very much, Barbara, for joining us on Hubwonk again. You've been a great guest, and I'm sure our listeners are eager to learn more about the price transparency. Thank you.
Thank you, Joe. Thanks for doing this.
This has been another episode of Hubwonk. If you enjoyed today's episode, there are several ways to support Hubwonk and Pioneer Institute. It would be easier for you and better for us if you subscribe to Hubwonk on your iTunes podcatcher. If you'd like to help make it easier for others to find Hubwonk, it would be great if you offer a 5-star rating or a favorable review. Of course, we're grateful if you want to share Hubwonk with friends. If you have ideas or comments or suggestions for me about future episode topics, you're welcome to email me at hubwonk@pioneerinstitute.org. Please join me next week for a new episode of Hubwonk.